Good evening. This is What's Going On. I'm Jon Li. Our guest this evening is Janet Wagner, RN, the hospital administrator at Sutter Davis Hospital. Sutter Davis in 2013 received the Malcolm Baldrige Award for Quality in Business. It's the equivalent of the Nobel Prize. It's a very distinguished award. Janet, I'm really pleased to have you on our show tonight. Thanks for coming.
Thank you, John, for this great invitation. I couldn't be happier to be here with you this evening.
Well, I hope you have fun. So tell us a little about the Malcolm Baldrige Award and what it took for Sutter to get it, and then we'll talk about you and your career, and then we'll talk more about Sutter Davis.
Great. The Malcolm Baldrige Award was created by Congress in 1987 by Malcolm Baldrige, who, by the way, lived in Walnut Creek. So I think we are the closest recipient of the Baldrige Award to his hometown, which feels really good. But the Baldrige Award, it's a national quality award that comes out of the Office of the President and is managed through the Department of Transportation and Commerce. And it was created so that industries in the United States, businesses, could remain and would be globally competitive in that global market. And so it's really a framework, a leadership framework that helps businesses to assess or self-assess where they are and to keep them in that top decile echelon so that they can be globally competitive. And even though Sutter Davis Hospital isn't a global, we're not competing in the global economy, we took a look at that criteria and said, why not? Why couldn't we use this framework to make what we do in healthcare all the more successful or better for the patients that receive our care? And it was really a self-assessment tool that we looked at, and it actually works. We have, over the last 10 years, sustained results and have been very successful in improving the care that we deliver at the bedside.
I think that's true. I'm excited to have you talk about that. So, how'd you get involved in nursing? What were you like as a little girl?
So, how did I get involved in nursing? Well, I went to a grade school that was catty-corner to a school of nursing. And when we were out on the playground, I could actually see the nurses. In those days, they lived in a dorm, walking down to a hospital that was in our community. And nurses in our neighborhoods were very well respected. If your mom was a nurse or someone in your family was a nurse, it was a big deal. And so from the time I was in grade school, it was definitely something I thought of becoming as an adult. And sure enough, I did. My sister is also a nurse, and I have one brother that's a physician. So medicine has made a big impact in my family.
So where'd you grow up?
I grew up near Pittsburgh, Pennsylvania. And Pittsburgh is a very big town in terms of medical care. There's a lot of good medicine practiced in Pittsburgh.
So tell me about your childhood and how your life went and what your parents did and stuff like that.
Okay. Well, I was very fortunate to grow up in a fabulous family. I have one sister and two brothers. My mom was very big on education, so if nothing else, we were all going to get a fabulous education, and we did. That was the number one on her list for us to accomplish. And we had opportunities. My sister and I both went to private girls' schools most of our career, most of our childhood, and through high school. And I may have also had an effect in terms of choosing a profession in those days that was mainly female. I don't know. But it was just, I would say, a very stable childhood. You know, we very close neighborhood. I guess the other real important thing is that growing up in that area of the country, you learn to ice skate, and we ice skated every night after we did our homework. So we were very active children.
I have a friend who's from Minnesota, and he says that their high school has a marching band that performs on ice skates.
On ice skates.
So, you know, my parents are from Michigan and Ohio, so they're used to winter. We're not.
Great.
We have a very calm, you know, we're lucky if it rains during the winter. So where'd you go to college?
So, okay, so now you're getting into an interesting area of my life.
Good.
I guess this will bring out the risk taker in me and decision maker. I started college in Pittsburgh at Duquesne.
Okay.
And then, being the decision maker and risk taker I ran away and got married after my sophomore year. And I'm happy to tell you that I've been married for 43 years to the same man. So my husband...
So it turned out not to be a risk. It was a decision, but it was worth it.
That's a good point. It wasn't a risk. It paid off.
Good.
So my husband was in the military. And so my education after that was really a patchwork because I left Pittsburgh and then ended up in Topeka, Kansas, where I did a little bit more of my nursing. And then Nixon happened to be in office, and he started to close Air Force bases. And so we moved after a year and ended up in Little Rock, Arkansas. So I ended up graduating from nursing school from the University of Arkansas for medical sciences. And then went on to get a master's degree in burn and trauma in Ohio.
So what led you to decide to get your master's?
At that time in my career, well, my husband, being in the military with my husband, I was following his career, and we were moving a lot. So getting a master's degree seemed to would help stabilize my career a little bit, and I may not start on the night shift in every new hospital that I worked at, because that's the other thing that happens is when you're new in town or you're new at a job in a hospital, usually start on the night shift. So I pursued the master's degree in burn and trauma, which was an area that I love, and I still love it. It was more about doing research and publishing a little bit more than actually improving as a nurse, I think.
And where was this?
I did that at the University of Cincinnati.
Oh, cool.
Mm-hmm.
Cool.
And Cincinnati, by the way, had the first emergency residency program in the United States. And that was how I chose to go there.
And your husband was stationed nearby?
He was stationed in, let's see, we were in Cincinnati and he was in, I can't remember the city, Dayton, Ohio.
Oh,
because
right.
My husband was an Air Force Academy graduate, and the graduate school for the Air Force Academy is in Dayton at Wright-Patterson Air Force Base.
Okay, good. Mm-hmm. So my family grew up in Dayton, so I know something about Dayton. Mm-hmm. I'll just say that I'm a Cincinnati Reds fan. We'll leave that there, but that's a long story, so I'll tell you that one later. So then what happened after you got your master's?
Then I actually ended up at Washington University in St. Louis because my husband was stationed in Illinois at Scott Air Force Base, and had a fabulous practicing career at Washington University as a clinical specialist in burn and trauma.
Cool.
And enjoyed my years in St. Louis. Of course, we were not to stay there. We were transferred again after that to North Carolina, where I actually transitioned in the mid-'80s to administration.
Okay, well, that's exciting. How did that happen?
That happened, we were in North Carolina, and I was once again looking for a job. And in North Carolina, there were fewer choices in the city that we were in. We had 2 hospitals, and the hospital I ended up in, there weren't clinical jobs available. And so I ended up in administration, and I had some very good mentors there, and ended up on an administrative team, learning to do strategic planning and learning some about marketing, and that's what propelled me into hospital administration. So
how large a scale?
This was a very big hospital, the one in North Carolina, at 500 beds.
Okay, and what was your role?
My role there was on the administrative team in strategic planning and marketing.
So you jumped straight to the top.
I did.
And how long were you there?
We were there just under 5 years.
That's a long time to be stationed in one military. Usually 4 is pretty much maximum.
Yeah. And I would say You know, early in my career, following my husband, at the time, it felt like we were jumping around all over the place. I didn't have longevity anywhere, and I like to tell people this story. When we were in St. Louis, when I was in St. Louis at Washington University, and we were getting ready to leave, and I was always sad to be leaving. I asked them to please not get me anything in the way of a gift. I wanted a 5-year pin. I had never achieved a 5-year pin. I had longevity nowhere. So I said, please, is there any way that I could get special dispensation to get a 5-year pin? I need a 5-year pin. I want to feel like I belong somewhere. And actually, they made it happen. I was just under 5 years in St. Louis as well, and I have it, and it means a lot to me to have that pin because I know I didn't earn it by being there for 5 full years.
It's like Roger Maris getting 61 home runs.
It meant so much to me that they gave me that 5-year pin, and so and then we were just under 5 years in North Carolina, and of course, since I've been with Sutter Health, I have been with Sutter Health almost 25 years, I believe, 25 or 26 years, somewhere in there. I have lots of pins from Sutter Health, of which I'm very proud. And I think if I hadn't spent all the time that I have with Sutter Health, we would not have been able to achieve the things we've achieved in Davis. So that longevity means a lot.
Yeah, that's going to be a lot clearer a half an hour from now. Right,
Right.
as we talk and you explain what it is,
Right.
what are the challenges that you face. So you went from North Carolina to Sutter Davis? Or to Sutter?
Actually, from North Carolina, we did, my husband was stationed at McClellan, and he had the last flying squadron there.
Okay.
And that's when I joined Sutter, back in, I believe, 1989.
Okay.
And Sutter Davis was my third job.
So let's start.
Okay.
So where'd you go Sutter first?
First to the system level.
Okay, and where were you located?
Sacramento.
And what was your role?
My role was working with the governing boards, trustee education. My very first role in Sutter Health.
And how did that happen?
That is very interesting because I did not have a background in trustee or governance or working with boards.
But you did in strategic planning.
I did in strategic planning, that's right. And so, again, this was the story of my career. Every time we moved, I was looking for a job, and this is the job I was looking for. I wanted to manage an emergency room. That's what I wanted to do. I'm a trauma nurse, so I wanted to be right in there where I felt the most comfortable, right? And there usually were no jobs available when we would get to a place in the emergency room. There were a few times, like at Washington University, where I did have an opportunity to be in trauma centers. And even after I transitioned from North Carolina, and I was on an administrative team, I was still very interested in going back to the emergency room.
Yeah.
But that didn't happen. So the opportunity arose that I was actively looking for a job, and Sutter had this job available. I was willing to learn and work with the incumbent person in that position. Pat Hayes was the CEO of Sutter Health at the time.
Right.
And he was willing to take a risk on me in that job, and I stayed in that.
Give you an opportunity to grow again.
To grow again, there you go. And what a valuable thing to learn, working with the governing boards, working with the CEOs.
Working on your communication skills. I mean, it was stuff that you knew, and being able to explain it to essentially your public.
Yeah.
Being able to have them effectively make decisions is really important.
Yeah. And it was a rewarding job. It was very rewarding. At the time, Sutter Health was only 12 hospitals when I joined. And having the opportunity to work in every community with every governing board and CEO, very rewarding to see the system grow as it did and be there when it doubled in size in 1996.
Right.
Very valuable.
So how long were you in that role?
5 years.
So from 89 to 94. So we're
93, yeah.
Okay, so then there was one other thing that you did before you did Sutter Davis.
That's right. So about in 1993, there was a reorganization in Sutter Health, and Pat Fry was coming into Sacramento to be the CEO of Sutter Medical Center, And I had worked with Pat a lot when he was CEO at Sutter Davis.
Right.
And he was very instrumental in my career and offering me opportunities. So Pat offered me the opportunity to join him at Sutter Medical Center as his chief nurse. And that took me back into day-to-day
Wow,
operations.
yeah,
It was a
big
bit, you know
time.
what, it was a wow. It was.
Yeah, big time.
Uh-huh.
Get your hands dirty.
Yeah, well, that was a very important point in my career.
Yes.
And I will never forget what Pat did for me.
Well, that's throwing you into the fire. I mean, it's putting you in the kitchen.
Mm-hmm.
I mean, all the orders are coming in at the same time. You've got to be able to deal with everything. I
Right.
mean, it's not just the trauma of the front end, it's the trauma of the whole thing.
It was. And working with Pat, nobody had a small job. Pat challenges everybody, and he was a great mentor. He was really, really good to work with. I look back on those days of working with him every day, and wow, it was, Pat was always challenging us every day to be creative and to make something of what we were doing, you know, make it worthwhile, make it rewarding, do something with it, not just come to work every day and, you know, status quo.
Okay, play management science teacher. Describe Pat Fry as
Oh
a
my
manager.
gosh, you want me to describe
Yes,
that on
yes,
TV?
yes.
Yes. Okay.
Don't talk about his weaknesses, but talk about his strengths.
I would, yes.
I don't want to get you in trouble, so, you know.
Thank you, John. Thank you.
Oh, my pleasure.
No, I will tell you, as I said, Pat gave me huge opportunities, and working with him and watching his leadership style, Pat is direct. You always know where you stand with him. He's got a huge vision, which I think has played out for Sutter Health incredibly well. He stretched us, but he was always there for us. He's a team guy. You know, when you're on his team, he takes care of you. And I don't know if that comes from his football background, but he's a good coach. He is a very supportive coach. And you know, I can't say enough about having had that experience working with him one-on-one. You know, it was valuable. I'm glad I had that opportunity. It gave me things to take forward as a leader in my own career. And wow, look at Pat now. He's been CEO of Sutter Health for several years, and Sutter Health is very successful.
So, are there strengths that he has in the content of what he's doing? I mean,
he's solid. I think Pat has a vision, and he is a strong executor. He doesn't, I mean, you know, Pat's always on the move. You know, he's always taken Sutter Health to the next level. And he's never been one to hesitate. And he's solid in his decisions. And, you know, people that work in Sutter Health can just look around and say, Pat did that, Pat initiated that, Pat started that, or Pat had the vision for that. Even, I can remember when Pat was CEO of Sutter Davis,
right,
and I was
right.
working in my first job, he had a vision for regions. And we had the first region in Sutter Health, and he organized that. You know, so Pat has a lot of accomplishments to his name, and
Good.
I'm sure there are many more out there.
Well, good, good, thank you. So how long were you Chief of Nursing Operations for Sutter Medical Center?
Till 1998, so from 93 to 98.
About 5 years.
About 5 years. 5 years everywhere, and then transitioned to Sutter Davis Hospital. Joined the Davis community.
So you've been there since 98.
Mm-hmm.
So what was Sutter Davis like when you got there, and this is a setup in terms of the before and after in terms of Malcolm Baldrige, and how was it, what was good, what was bad, what were problems, what were areas that you saw could be improved?
Mm-hmm. Well, the good news, or the great things about Sutter Davis Hospital is that they have always had great people. You know, I inherited really, really fabulous team of people there. Many are still there from the time I started. Some have retired, some have been promoted. You know, there's lots of opportunities within Sutter because we have a large system. But it was a small community hospital. I think when I got there, our average daily census was about 10 or 12.
Wow.
And, we've more than doubled that. And we've increased the number of types of services that we offer, and the physicians. And actually, when Pat Fry was there, he created a medical group, which was just fabulous.
At that point, the industry was just starting to adjust that. Up until then, a hospital did not have any on-staff physicians. The insurance industry, the administrative structure prevented all that. I mean, that was a legal battle.
Yes.
That was just finally getting to be resolved. The whole profession of being a hospice, or anyway, a physician who works in a hospital,
Right.
is really a whole new field
Whole new.
that started at that point.
Right. And so I inherited a lot, a medical group, a great team of people. And the people in Davis, always willing to be flexible and agile and move with the economy or the markets, which is incredibly important. A lot of times, and I can say this being a nurse, we can be rigid. We can be rigid, and we can be, one way, my way, instead of being flexible and agile. And in this healthcare environment that we're in now, it's about change, and it's been about change for many, many years. So what we say now is change is the constant. And with the Affordable Care Act and Total Care Accountability, it is all about being very agile and changing faster than the market's changing. So I inherited a lot of really great things at Davis. There are always, even now today, there are always things that we can improve in healthcare. So always wanting to strengthen nursing, because I'm a nurse, and I want to always have great nurses and great clinicians. We had great doctors. We still have great doctors. Davis is very, very lucky because we attract a very high caliber of physician. They love to live in Davis. It's a great community, and it's a great place to practice. And we have a great university in town too, I might add. So, and we always have that in the backs of our minds. And so that was one of the things about thinking about this Baldrige journey, in terms of, we could have said, well, we're just a small community hospital and that's that. But that's not what we said. We said, we have a lot of great things to build on. What is it that we do better than anybody else? And we can show the world, And a lot of it came from the people. And it's exactly that. It's the culture of the people at Sutter Davis Hospital. When I would walk around the hospital and say, what do you like about working at Sutter Davis Hospital? They'd say, I like working with the people I work with. I like being in the community. But it was that connection, and that's actually what moved us to our culture of caring and how we arrived at what it is that we do best. And you would think that, it would sound something like, well, we're a hospital, we take care of people, and we do. But it is the culture of caring that really cemented how we behave, how we take care of the patients that are in our hospital every day, or in our emergency room, or our doctor's offices, how we care for each other as team members, very important, and how we take care of the physicians that practice in our hospital. So our culture of caring goes very deep into the threads of the fabric of our team at Sutter Davis Hospital, and everything emanates out of that culture of caring in terms of what we do, who we are, what we believe in, about how we're going to take care of people when they're in Sutter Davis Hospital. And for me, I would say one of the most important things as the CEO is that we want our community to trust us. Every day you're reading in the paper that, about something unsafe or medication that's wrong. So for me, having safe patient care delivery, courteous staff that are professional and competent, extremely important. And that's what we want the community to know, feel, and experience when they're in our care.
So, 1998.
1998.
That was when you got to Sutter Davis. When did you find out about the Malcolm Baldrige Award, and how did you get into that process?
Yeah, so it took about 3 years to really get into Sutter Davis Hospital and understand the culture, understand the people and the processes that we had there. And it wasn't, and then in 2003,
So it's 5 years.
5 years. Oh yeah. Okay. So I'm.
No, I'm just trying to keep track here.
That's.
I'm
good.
a health planner. You know, you give me a date and I try and put it in the place in my brain.
Okay, so from 1998 till 2003. In 2003, our system, and this is the great part of being part of a system, is that our system decided to engage the Studer Group. And we began really paying attention to behaviors that link to outcomes in service. And that was new for healthcare at the time.
It's new in social service delivery, but it's also a concept being used with juvenile delinquency and kids that are truants. I mean, it's a great idea.
Yes.
It's trying to get your arms around the resources and then having some outcomes that are productive.
Right, and so service is a big deal right now. You know, in terms of, it's not just the technical quality of the care that we deliver, but it's how we treat people, our compassion, our caring, how we show that.
It turns out that's the most important thing.
It is, and so it also takes some. It's not intuitive. It's just not common sense. There are specific behaviors and things that you do when you're in the presence of patients or your team members that are respectful and that people see and they hear when they're in your care. And we became very cognizant of that. And so we spent a lot of time refining our behaviors. Actually, at least, let's see, it was from 2003 to 2007 that we worked on service and behaviors around service and got coaching. And we actually do measure our patient satisfaction, which we now like to think of as the experience the patient has when they're with us versus them just being satisfied with care. And then I would say, and it sounds easy, but it's not that easy to do with hundreds of people delivering care 24 hours a day, 7 days a week. And it took us several years to really hardwire those behaviors. And there aren't a lot of them. That's another secret to success. There are not a lot of things that you have to do, but you have to do them consistently. That's the hard part.
So can you give some examples?
So some of the examples are that when you go into a patient's room, you introduce yourself, you tell them what you're doing, you tell them how long it's going to take, and you thank them for choosing us for care, and you do that consistently. When you're giving them a medication, you check their armband, you have indicators that you're validating and making sure that it's the right patient, the right medication. So these behaviors are visible, they're audible, and as I said, there aren't many of them, but they have to be done consistently.
Well, when you think of what a nurse is supposed to do, I think that those two things are pretty high on the list.
Pretty high on the list.
I mean, introduce yourself, find out that it's the right patient, and then find out that you're doing the right thing seems pretty important.
Yes, very important, especially for the patient. So what we talk about is hardwiring those behaviors, those few behaviors, and really holding people accountable to them. And then the reward is seeing the outcome. When a patient fills out a satisfaction survey, you see, oh, look at this. They really did appreciate that I was consistent, that I was safe, that I, did all the things I said I was going to do, and they understood it, and so those things are rewarding. They're measurable, and you can sustain results if you're consistent in what you do. So we call that hardwiring. And the definition for that is that 90% of the workforce would do a behavior 90% of the time. That's way more than a critical mass. And that's another secret to success in terms of this Baldrige journey. And so it wasn't until 2007 that we actually got serious about the Baldrige journey. And there's two levels to this process. One is a state level process, and the state of California has a very robust program that is parallel to the national program for Baldrige. The national program that I mentioned comes out of Congress, and the award is presented by the President of the United States and recognized by the President's office. The state level is a means of preparing you for the national competition or the national, being in that national arena. And so we took advantage of our state level program for 7 straight years. And by that I mean we worked with the team, they coached us, they gave us feedback on what we were doing inside our business. And I'm talking about business practices like leadership, strategic planning, our customer focus, our workforce focus, our processes and systems that we had in place, and our results.
Facilities is the only thing I can think of that you didn't include.
Right, didn't include, yeah.
I mean, it's every business has those issues.
Right. Oh yeah, and that's the other nice thing about the Baldrige is that it has absolutely nothing to do with healthcare in particular. It applies to any line of, it could be a restaurant, a school district, it could be your TV station. If you want to be successful and competitive, the Baldrige framework works for any size business.
Baldrige was such an incredible guy that as a businessman in Europe, as a businessman from the United States in Europe, he was recognized for his personal quality as a business leader. And that was before he became the Secretary of Commerce in the Reagan administration. So he brought the reputation to the award. It's an honor to get the award just because he was such an incredible guy. So that's, one part. Back in what you were saying, that reminds me, this is talking about nurses communicating. I'm a big fan of Abe Maslow, the psychologist, the hierarchy of needs and self-actualization. Well, right after he wrote a book on peak experience, he had a heart attack.
Oh.
And because he was Abe Maslow, as soon as he got in the hospital from recovering from his heart attack, he started interviewing the nurses. and what he asked them was when they had a peak experience. And they said 2 things. Now, obviously, these are mostly women. So they said when somebody else gives birth to a baby, and to actually be part of that recreation of life is just such a miracle that it's, amazing. But the other thing was, he said, when somebody who was really, the nurses said, when somebody who's really sick comes back and says, thank you.
Oh.
And just, when you're in need and a nurse is in service, the reciprocal relationship is unconditional. I mean, you're in need and the nurse gives you what you need, and as a result, you're able to feel better. And it's at a point in time that you obviously don't feel very good. So the nurse's role at a time when you need it is magic.
It is magic. And I will tell you, as a nurse, you never, ever, ever tire of seeing that patient recover or that family feel better about what you've done for their family member. That has to be the best part of providing care. And we get a lot of thank you letters and notes and oh my gosh. And we read them every week at the hospital. Every Tuesday at noon in my hospital, we have a meeting. Every Tuesday, it's 30 minutes, we call it Pulse on Pillars. We have 5 pillars. And we talk about our service to our patients and families and to the community. And if someone receives a letter or a call or a visit back from a family, which is very common at Sutter Davis Hospital, I can tell you there's never a Tuesday that we do not have something to talk about. That just what you said, a grateful patient and family. And we love those letters. We read them to the entire management team. And, as a nurse, I will tell you, you take care of a lot of people, and there are some that just stay with you for life, that you never, ever forget. And even though the patients may not remember you, you remember them. And I don't know if patients realize that that they make such an impression sometimes on their caregivers that they just stay with you. And so it's a very rewarding line of business to be in. Some say it's a calling, actually, because of what we do with and for people and what they do for us. Because you go home at the end of a day feeling rewarded.
Well, let me say what I know about nurses is you go at the end of the day with your legs hurting because you ran around so much and you know, according to the Center for Disease Control, the health professionals have the second highest rate of nervous breakdown because they're under so much stress. But the point is, number one are food servers. So when you think about a waitress and you go, will you give me the mustard? You know, you think about how many things are on their mind. Well, a nurse has that many things on their mind.
Yes.
I mean, so the other statistic I want to throw out from my favorite author, Stafford Beer, is the single best indicator on how good the quality of healthcare is the longevity of the nurses. That if the nurses are turning over rapidly, you know, and you were saying, you know, you start out on the night shift, well, there's, you know, statistically the night shift is when people are most likely to be neglected, and, you know, that adds together because you don't have the good communication. You learn the ropes, and then you get to do the weekends, and then you get to do the day shift. But learning the ropes is part of working on the night shift. I mean, it's something you have to do. And so somebody who's nursed for 6 months and they've done all 3 shifts is more likely to be reliable and somebody you can count on.
Yes.
And I mean, it's nothing against the person. It's just learning the system and learning the ins and outs and hearing what somebody says and paying attention to the patient, and at the same time paying attention to the information system. And each one's different. So
It is. And they call it, you know, we talk about medicine is medical practice, nursing practice, and they say that for a reason, because you need all that experience. You have to practice the trade to be good at it, right? I mean, you just have to practice it over and over and over. That experience is invaluable.
I was talking to a psychiatrist once, and he said that he was working as an ER doc when he was going to psych residency. And this woman came in and she was in labor, and he had to induce he had to induce labor. And so he goes, I read in my OBGYN textbook from when I was in med school, and I put the 4-inch needle in the right place, and I injected, and 5 minutes later the baby came out. So I guess I did it right. You know, that's not practice, okay? That's an experiment, right? You want to talk to the old OBGYN nurse who's seen it all and had the same problem happen 20 times, and 19 times it worked out okay because she knew what she was doing.
Right.
And you can only learn that the hard way.
Yeah. Unfortunately, there are not a lot of shortcuts to practice.
Yeah.
You know, the more you see, the better you get.
Well, I've been a fan of the problem-oriented medical record for a long time, because I think that way it's results-oriented medicine. You're not dealing with the symptoms. You're trying to find what the real cause of the disease is, and then putting together an information package that deals with the problems as they really are. But so electronically, are we moving in that direction?
We are.
So
Absolutely.
Talk about that.
Well, the doctors in Sutter on our campus, and all of the physician offices that associated with Sutter Medical Group have been on an electronic medical record for at least 13 years, I believe. And the nice thing about being in Davis is that those feed right into the hospital. So we have been able to access the office information in the hospital for 13 years, which is phenomenal. So, and of course that's the best thing for the patient. I mean, when I think of how we did it, and I don't want to say the old days, but I guess they are days past, there was no way that if you came to the emergency room, somebody was going to read your chart that was maybe that thick. It was impossible.
Even that?
Yeah, even that thick. There
inch?
wasn't enough time,
Yeah.
right? So now the physicians, and it has been for the last at least 13 years in Davis, that our physicians in the emergency room or anywhere in the hospital, in the birthing center or medical surgical units, could just log on and get the information from the physician's office, see the last visit, your last labs, laboratory work, anything that might have been done to you, and get a picture of what that doctor was planning.
Sure.
And now in January, we most of the departments in my hospital do have computer systems in them and are electronic. They're not on one platform. And so in January, at the end of January, Sutter Davis and our entire region will be going live on Epic, which is one platform. and actually the entire Sutter system is already on it. So we are the last ones to go live, and that is just months away. So we will be able to connect everywhere. Actually, it'll be incredible. So that's great.
Back to the Malcolm Baldrige Award, what steps did you take? So you talked about up to 2007, you were focused on the state process.
Mm-hmm. Mm-hmm.
How did it evolve?
So how that evolves is that California is in sync with the national. So we submitted 2 applications. They call them applications, but really it's a 50-page book about Sutter Davis Hospital. It's our story. The thing that's important to know about the Baldrige criteria is that it's a self-assessment. So when the examiners come out to look at your business and how you're doing business, based on the things that I mentioned before, leadership, customer service, strategic planning, they examine you based on what you put in that application. So because California's in sync with the nation or the national program, we submitted 2 applications every year. One to national and one to state.
Sure.
It wasn't until our 2012, so from 2007 to 2012, we were not mature enough, as I say, we were not mature enough in our systems and processes and results to be worthy of a national site visit. We got state site visits. That means the examiners came on site for a week, they stayed with you, they examined what are you doing, you interview. They can tell pretty much whether or not you have matured your systems and your processes to get consistent and sustained results. And that's why it's a journey and why it takes so many years, because you really have to align behaviors and systems and processes and execute consistently year over year over year, regardless of what's going on. There are no excuses in terms of results. So it doesn't matter if you've got the Affordable Care Act coming down the pike, or you've got a drought, or you've got whatever.
Well, those both happen.
Yeah. Or what I'm saying is it's not a process where you should feel comfortable making excuses about why you didn't get results.
So the first comparison I want to make is between the 3rd and 4th grade. Mm-hmm. That when you're in the 3rd grade, when you look at it from the 6th grade perspective, 3rd graders are really dumb, but you learn so much in the 3rd grade that when you get to the 4th grade, when you talk to a 3rd grader, they're a loser. I mean, you're so much smarter than the 3rd. Well, it's the same way with the 10th grade and the 11th grade, right? It's the same with the 1st year of med school and the 3rd year of med school.
Right.
Somebody who's a 3rd year med student starts listening to a 1st year student, and they have all kinds of holes in what they don't have their education yet. Yep. And the first time you do OBGYN, you think you know what's going on. Your wife had a kid, and you're amazed at how little you know.
Right.
And how much more there is to know, and how many different kinds of concerns that you should have experienced and have paid attention to. I'm a big fan of Oliver Wendell Holmes. Mm-hmm. The father was a physician, the son was a jurist. The father wrote the poem Old Ironsides to save the USS Constitution, so it's a national hero. Mm-hmm. Then he went to med school, then he went to Paris for 3 years, and in Paris, half of the hospitals in the world were in Paris. They had one hospital that the nuns ran that was a maternity hospital. You could see more babies born in Paris in that hospital in one day than you could in your career in the United States at that point. These guys came back from Paris to the United States and started teaching medicine. So that the next generation went to Harvard and Dartmouth. They didn't have to go to Paris.
Yeah.
So, we're slowly learning how to teach and carry it on to the next generation. I forgot why I brought up Oliver Wendell Holmes, but I love this story. And it's from a book called The Distant Journey, about how Americans were transformed by going to Paris. And I could go on about that for an hour, but that's not this. This is about healthcare. So how's Sutter Davis now? How has the Malcolm Baldrige Award transformed the hospital in terms of today and in the future?
Well, the team is very cohesive. they value systematic approaches, systematic deployment, integration between and among departments. I think some of the biggest rewards we got out of this was really understanding benchmarking consistently. This took our team to a place where they never dreamed they could get or even thought about going. You just never think about a small community hospital on a national stage.
Sure.
Being a role model in your industry. And yet I think our discipline and our focus over the years and our willingness to keep getting better and accepting that feedback, like you said, I think your analogy was excellent between
I'm actually finding what it was.
Yeah.
Go ahead.
Well,
go
the
ahead.
third year resident
Sure.
and the first year,
Sure.
and so when we started on this journey, we weren't systematic. We didn't have all our processes in place. And the examiners would come in and find those holes. And they were very honest with us. They didn't hold anything back. They had nothing to lose. We had everything to gain.
Right.
And I think that candid feedback is important that you don't always get from colleagues. And so that made us stronger. And I think if you would talk to anybody on my team today, they would tell you that work life is easier, it's more rewarding, they feel more confident in what they're doing because they know what they're doing and they've gotten the feedback over the years. We have consistent practices in the hospital that people value because they lead to results. I think they would tell you that they're working smarter, not harder, and it's hard to understand that if you haven't experienced it. And the other thing is it's hard to explain to people why you have to go on the journey. And there's no shortcut on the journey because it's experiential.
Right.
It's experiential. It's just like, I guess, a physician, you could say, you can't say, well, let's skip years 1 and 2 and we'll get you to the third year. You can't, because you have to do those surgeries or you have to examine those patients for yourself. And that's kind of how it was on that journey, was really understanding what we didn't know and why we didn't know and putting the pieces together. And it was, I would say, on the second year, when we had our second year site visit from National, was we didn't even think we were ready. We thought we could use it. We wanted another year to really get it together even better. And I would say the year after this year, we have done more, put more things in place, and recognized more deficiencies. So people might say, oh, come on, how could you have deficiencies? You're a Baldrige winner. But we can see where we can still go to that next level and that next level. And I think that is incredible value that you get out of embarking on a journey like the Baldrige.
So my first comparison is, it's like now you're ready for grad school. You're ready to actually refine what it is that you figured out what you're doing. But I have to tell you that my other idea is from Stafford Beer. It's called the viable system model. And it's a way that you take a layer of a bureaucracy and look at its subsystems and its suprasystem and then deal with the communication so that you don't have miscommunication with some lower layer. Mm-hmm. And it's a lot like the process that you've gone through, because what you do is you set up something that you can objectify the information about what you're doing and then compare reality to what you've described. Mm-hmm. So that when you come in when you have your book and the examiners come in, what they're really doing is saying, this is what your book says you're doing and this is what we've assessed. Mm-hmm. And on these 90%, you do seem to be doing what you claim you're doing, and these are the things where you have cognitive dissonance, where you have an incongruency between what you're claiming or what your standard is. Now with the viable system model, you identify 12 criteria and you measure those every day. Mm-hmm. And from what little I know about what you're doing, you do have that kind of close scrutiny on what it is that you're looking at and what you want to improve or have be at your highest standard. So there are different ways that people are systematically looking at their mission and trying to accomplish the large scale by individual action. And it seems to me that that's a culture of caring. I mean, it seems to me that with that phrase, you've done a lot to embody what it is that you hope each employee is doing from the moment they step on the hospital grounds until sometime after they leave. So what do you hope for the future of Sutter Davis?
Continued success. But more importantly, the number one thing for Sutter Davis Hospital is that we take care of our community and the people that live in our community. And I think of that in a couple ways. I mean, that's what we're there for. We are there, we're a hospital, so we're there to make sure that the people in our community feel safe in our care and that they will use us and that we never let them down, that we have competent caregivers who are always there for them 24 hours a day, 7 days a week. The other nice thing is we are a small community hospital. We have sister hospitals very close. So there, you know, if we need to transfer a patient out of Davis to Sacramento, we have a hospital there right away to accept that patient in care. So those things I think are always going to be number one on the list. And always number one is the patient and the care that we can give to the patient. And then I never forget either this, because in the United States, people on the highways and byways, Interstate 80, we're taking care of them too. And you know, it's amazing the people that we get who are just passing through or traveling through that we also extend care to. Of course, our community is the most important to us, but we also have people that are traveling those highways and byways, and we want to also be sure to take care of everyone that comes through our doors. So. But that's what I hope for Sutter Davis Hospital. I think community hospitals play a very important role in communities. Just having that safe care close to home and convenient, not just the emergency room, but even as our populations age or as we have illnesses like cancer. You know, we want our cancer patients to get the very best in care, and some of it they may have to get in Sacramento, where some of the big surgeons are, but for that day-to-day chemotherapy when they're frail and not feeling well, we don't want them to have to travel very far, so they can come to the campus that's closest to home. Things like that.
So a year ago I had that thing that happens when you're a fourth grader and you feel your stomach and it doesn't feel quite right. And I went to the hospital, I went to my clinic, and my doctor said, "Oh, I think you have appendicitis."
Oh.
And so I went to your emergency room. It's the first time I'd been in a hospital in 40 years. And I just want to thank all the nurses. So I'm going to just say Gretchen and Greg in ER, Heather and Sarah in surgery, Elizabeth, Lena, Nancy, Carlos, and they were in my
Med-surg?
were in my hospital room.
Yeah, in the medical surgical unit.
And then Toby was my discharge nurse.
Yes.
And so they were delightful, and I have to say that it enhanced my care.
Oh.
Part of the reason I'm doing the show is because the experience I had was a culture of caring.
That's nice.
And I think it was really special.
That is very nice to hear.
For sure.
And they will love hearing this as well. Like I said, they love when they hear from patients and when the experience is like you've had a great experience.
Well, not to neglect the big time pro, but my surgeon's name was Alicia Silva.
Oh yes, Dr. Silva.
And when she examined me a week later, she says, "Oh, good, you're not gonna be able to see the scars." And I have to tell, they use laparoscopy, and so they inflated my stomach with carbon dioxide and just went through, and I can tell you where they are. There's supposed to be a scar here, a scar in my navel, and a scar here, and I can't find them.
Wow, that's great.
So, you're used to saying, "Oh, the kid had an appendectomy and it's got a great big thing."
Now you can't brag about this, the scars. No bragging.
And a week later, she said I could ride my bicycle. So,
wow.
The recovery is much better. That's one of the miracles of modern medicine.
Absolutely, it's getting better every day. Every day.
So, in the minutes we have left, what's your advice to girls that want to go into healthcare?
Oh, I hope, listen, we need some big talent to go into healthcare. So my best advice would be for young people to really explore all the options, because there are lots of options in healthcare that provide very good living and are extremely rewarding. And right now, you read every day in the newspapers that there's a shortage of physicians and a shortage in this or a shortage in that. And so for a while, I think the tech companies were attracting a lot of our talent, but healthcare is a viable option for young people to explore. And so I hope they do.
It's a tough row.
It is.
You have to learn a great deal.
You do.
So I'm stalling now. We have a minute or two that I want you to talk.
Okay, I'm going to tell you what I think is what was one of the most rewarding things for me in the Baldrige journey.
Good.
And that was that my team at Sutter Davis Hospital had the opportunity to experience not only the journey and the growth and the maturity, but also the recognition of going to the East Coast and actually receiving the recognition in front of an international audience and presenting and educating people from all over the world, from a variety of industries. And the one thing that I would say for me in all of this was the patient, was making sure that we were one of the best hospitals in the country for our community. But for my team, when I look back on this, it is indescribable to be able to give your team something that is theirs, that no one can take away from them.
That they've earned.
That they've earned, that they can put on their resumes. It's just, for a CEO, there's very little sometimes. You want to thank people and be grateful for what they do day in and day out for you and the community and your mission and your vision. And having something this great on their resumes and this experience, when I look back on it, any CEO would be proud to be able to give this to their team.
Well, I want to thank you for being on our show. We have a picture of the Malcolm Baldrige Award, and I was supposed to show it earlier. It seems like the best way to end the show.
Fabulous.
So this has been What's Going On. Thanks for being with us.
Thank you.
Good evening.